Do your joints feel stiff, painful, or swollen? If so, you're definitely not alone. Arthritis touches millions of lives around the world, including many folks just like you and me. Today, I want to break down what arthritis really is, what causes it, the different types, and most importantly, how you can treat it and get back to living your life. Let's start with the basics. Arthritis isn't just a single disease. It's actually a whole family of conditions that cause inflammation and damage in your joints. Think of your joints like the hinges on a door. When healthy, they move smoothly and painlessly. But with arthritis, that hinge gets inflamed. The cartilage, which cushions your bones, starts to break down. The result? Swelling, pain, and stiffness that can make even simple movements difficult. This can happen in your knees, hips, hands, or even your spine. So, what types of arthritis should you know about? The most common one is osteoarthritis. That's simply wear and tear as we age. Over time, the cartilage wears down, and your bones may start to rub against each other. Then there's rheumatoid arthritis, which works a little differently. Here, your immune system actually attacks your own joints, causing inflammation and pain. You might also hear about gout. That's when uric acid crystals build up in a joint, often the big toe. Psoriatic arthritis affects some people with skin conditions like psoriasis. And finally, there's post-traumatic arthritis, which can develop after an injury. Each type has its own quirks, but they all have one thing in common: joint pain and reduced mobility. Now let's talk about symptoms. What should you watch out for? Joint stiffness, especially in the morning, is a big red flag. You might notice swelling, tenderness, or even warmth around a joint. Maybe you hear grinding or cracking sounds when you move. If these symptoms stick around for more than a few weeks, don't brush them off. That's your sign to see a joint specialist and get a proper diagnosis. So, what can you do about arthritis? Good news, there are plenty of options, and treatment depends on how severe your symptoms are. For mild cases, regular exercise, losing extra weight, and taking prescribed medications can make a big difference. Physical therapy can help keep your joints flexible. If things get more advanced, you might need injections to reduce inflammation, or in some cases, surgery. These days, procedures like robotic surgery and minimally invasive joint replacements are available. They're precise, less painful, and usually mean a quicker recovery. But here's the most important part: you can still live well with arthritis. Staying active, whether that's walking, gentle yoga, or gardening, helps keep your joints moving. Eating healthy foods, keeping up with your appointments, and following your doctor's advice makes a world of difference. With the right treatment plan and a few lifestyle tweaks, you can manage your arthritis and stay active and independent. If you're ready to take the next step, reach out and book an appointment with Dr. Pramod Chahar. Early diagnosis, expert care, and a recovery plan tailored just for you. That's the key to long-term joint health. Remember, joint pain doesn't have to control your life. The right knowledge and support can help you move freely and feel better every day. Visit drpramodchahar.com to book your appointment and start your journey to pain-free living today.